I understand.
Dr. Kain Hoedoebecke, thank you for sharing your time with us for this interview. You are with nearly about 20 years of leadership experience in the clinical, academic, and military field of general practitioner. It's a huge thing. You are currently the medical director at Oscar Health, where you are helping ensure patients around the United States. And you have some responsibilities in the Wonka Polaris, I think, also.
Yes, so I was one of the founders of Wonka Polaris, our Young Doctors Movement,
Yeah.
and I still serve as an advisor there, and also with the American Academy of Family Physicians, AAFP.
Yeah.
I work with their global health member interest group as well. I'm the vice chair.
And you are the one who introduced me to the General Practitioner World Day. I didn't know it before you. We did that beautiful work years ago,
Mm-hmm.
5 or 6 years ago. Yeah.
That was a lot of fun. I remember. Thanks for
Yeah,
helping with.
it was a beautiful thing. Okay, can you please share with us the experience of the US general practitioner during this sanitary crisis?
Sure. So the experience is varied. It's different for each location as well as depending on what each GP does. So many of our emergency GPs that work in the emergency setting,
Yeah.
their numbers went through the roof and have been working nonstop. Those in the clinic, more standard clinical setting, in the outpatient clinic, some have had to close down all the way, while others have still been able to operate, but with appropriate measures that keep patients apart. For example, we still see our pediatric patients and adult well visits. So for example, some of my friends and I will put them in with a specific part of the day so that only like really well visits are at the same time. And those sick patients, try to put them together at the same time as well, instead of mixing sick and healthy patients. And then also instead of the traditional seeing patients back to back to back, we have to stagger it, change it, and be able to spread out
Yeah.
the time in between seeing patients.
And measures of protection are very hard to put on or not? Is it easy to have them or not?
It's getting easier to get like PPE, the personal protective equipment. It our country is broken down into different states, and unfortunately, there's not really a good national response, and the states are fighting against each other to get more of the equipment.
Okay. And how is the family doctor's work changing in daily basis, a part of making different hours of working? Is there any real feeling of change?
Yeah, there's been a lot of change. So the biggest change has been there has been a slow trend towards telemedicine, but since COVID-19, it's skyrocketed. So I see all my patients online, and it's a way to still continue to give back, do good, while protecting myself, my patients, and everyone else. So telemedicine is the big number one change for GPs here.
Okay, and GPs in USA use it currently in their daily practice?
So yes, so it's there. There's been kind of two we say silos, two paths. Traditionally has been just in person and just telemedicine, but now they're starting to combine. So you could still see, for example, I have a patient, a heart failure patient. You could see that patient in person and then do a follow-up online.
Okay, okay. Continuing to follow what the patients online for avoiding to
Exactly.
to clinics for um, leisure symptoms. Okay.
Exactly.
How much are the GPs involved and participating in the development of pre and post hospital management protocols? In Morocco, all the protocols are done by hospital teams, so they are not adaptable to our practice as a GPs. How is the staff in USA?
So there are general guidelines from like the CDC, Center for Disease Control, as well as national and state guidelines, and those can be adjusted to fit the GP's clinical need. So each GP will need to take those and then and adjust them just to make sure that they fit into the correct scenario that patients are being treated.
Okay. Is there any helping for help from the authorities for the GPs in their practice during this crisis? Help of measure of protection. I think that the activity is going. It's a slow. It's not as always. How in the private practice? How it's going on?
So I've seen two trends. One for GPs as well as other specialties that work in a hospital setting. Mm-hmm. So I have friends like GPs that are still in a GP clinic but associated with the hospital. Oh. Because the hospital's income has gone down due to lack of surgeries, lack of elective treatments. So knee replacements and people coming in to get elective things that have been pushed off for now, their salaries have gone down. Also, those who have their own clinic, their own GP clinic, they have reduced patients, so their salaries have gone down because of that. So the government has offered some help in the form of stimulus, so some money to GPs, to all Americans, but also to GPs. And then for GPs that can't see enough patients to survive, they can apply for a government loan to help basically help make sure there's enough money to pay for medicines and staff and to keep the doors open.
The doors of clinics open.
Exactly.
After the COVID. Oh my God.
During if it's open during, but because of the costs are still there. You have to pay your employees. You have to pay the electricity, the rent. Everything is still there, but the income has gone down. So the loan is supposed to help get that number up so that you can pay for all your debts.
Are you thinking that the whole practice of general medicine are going to change after COVID?
Do I think we're willing to change or having to change?
Is there any real change in our practice after all
this? I think there will be in person a bigger focus on definitely on the safety aspect. So you'll probably see more one like physical safety. So the barriers will probably stay and things like that. And then there will be probably changes or continued changes in protocol to help ensure that people are safe from each other and they transmit as little as possible COVID as well as the next infectious disease.
Hope We hope that there is no other disease coming on, but it's a dream. I think that everybody is afraid of having another COVID or other virus.
Well, I mean, even if there's nothing else, we tend to have an annual flu season. So I think this will help ensure that we decrease those rates of transmission as well.
We are continuing to use this protections measure in our daily practice.
I think again, some of them will be used. We probably won't continue to have the 2-meter distance or the way that for example, some of our patients have to sit in the parking lot in their car and call, and then the front desk will say, okay, you can come in now. We'll probably open waiting rooms back up and things like that, but there's going to be some measures that stay. I believe some of these will stick and say, hey, that's a good idea, we should keep that.
Yeah. Any message to Moroccan GPs, Kyle?
Do I have a message? Sure. Hang in there. We're all dealing with the COVID-19 virus together, learning from each other, finding best practices. So just know that we're here supporting you in everything you do for your Moroccan patients. We appreciate you, and thank you for everything you do.
Thank you very much, Kyle. I appreciate this beautiful moment of sharing. Thank you very much. Take care of yourself, and good luck for continuing to be a leader of general practitioner.
Thank you so much for inviting me. Stay safe, and it was nice talking to you.
Hi.